And then I want to talk a little bit now about our attempts to try to look at the impact of conflict on the health system in Iraq. We started getting interested in this on the issue of migration of doctors. And it turns out there's actually very little literature on what happens to doctors in conflict situations. And doctors are part of an increasingly globalized workforce. People can move easily from one country to another. And in the situation of Iraq, where the basic training in medical education is in English, this is a very portable kind of skill. When one looks at the literature on migration of doctors, it turns out almost all the literature is focused on financial push-pull factors. So it's not really focused on issues related to conflict. We did manage to pull out a little bit of information on this. Cuban doctors leaving after the Cuban Revolution. Zimbabwe estimated to have lost a majority of the doctors trained during the 1990s. Wild estimates on the number of doctors who left Iran after the revolution there, so we don't know. This was an interesting figure that in the public sector in Sierra Leone and Liberia, it was estimated there were 400 doctors in 1997, and by 2003 it was down to 20. And again, anecdotal things, outer reports, and so forth. Now, we got interested in the situation in Iraq because news media had suggested large numbers were killed. Many had left, perhaps half. Some news accounts said 3/4. No data at all on this. So, is there any way we could look at this? And prior to 2003, it was estimated there were about 32,000 to 34,000 doctors in Iraq. So, a very large number. Any way we could look at this? So we did 2 studies to look at this. The first one was a survey of 12 tertiary hospitals in Iraq, 6 of them in Baghdad and 6 of them elsewhere. And these were 2 facilities in each of the locations except Baghdad. And one of the facilities would have been a tertiary general hospital, and the other would have been a university hospital. And we chose these because the specialist cadre of personnel was a highly mobile group, and these hospitals had quite good records compared with lower level health facilities. And then we had a second study, which I'll talk about in a little bit more detail, and that were interviews that we carried out of 401 Iraqi refugees in Jordan. And there we tried to look at both push factors and pull factors. Why did people leave, and what were their plans for the future? This report was in Social Science and Medicine last July, and prior to 2003, it was estimated that Baghdad had about half of the doctors in Iraq, even though it probably had about 20% of the population. During the period of time from 2004 to 2007, the number of specialists decreased overall in the country by not very much, by about 6%. However, in Baghdad, the number dropped by about 22%. And in other areas of the country, actually the specialists increased. And some people might say, it's not too bad because this was not an appropriate distribution of doctors in the first place. So this may be matched more effectively population needs. And this is what the figures look like for annual losses. So in 2006, which was the peak of the violence in Iraq, and particularly in Baghdad, the loss was 29%. So 29% of hospital specialists left during that year. And so there was some loss outside of Baghdad, but those losses were more than made up for by the people who moved from Baghdad into the non-Baghdad areas. And these, again, are tertiary hospitals. We looked at the various specialties. There didn't seem to be any pattern there. The surgical and non-surgical specialists seemed to leave at about the same rate. And then you could see this is the number of doctors present. And if we looked at areas outside Baghdad, those increased. And it wasn't just in the Kurdish areas in the north, which is what we had thought. Among doctors, the some of the minority groups are very heavily represented in the medical practitioners, and some of them felt more comfortable in the north, but many people from the south, in Basra, where there was violence going on, felt more comfortable being closer to home, being closer to their environment. So they would then move to those areas. So we found that we couldn't find out exactly why all the doctors left. We did some informant interviews. We examined the records, which were reasonably complete. But majority who left transferred to other hospitals in Iraq. And the general pattern was the doctor would suddenly disappear. And then about 2 months later, there'd be a request from some other hospital in Iraq, please transfer this doctor's records to our hospital. He's now working for us. So that was a standard pattern. Some retired, some left because of threats or kidnappings, some were killed, and some died from nonviolent events. We tried to look at the violent events, and we found that during this period of time, doctors experienced violent events at a rate of about 30 per 1,000 during this study period. Hospitals in Baghdad could replace, with incoming specialists, their losses until 2005, and then the losses exceeded the replacement. So let's go on and talk about the second one we did, and this one was, this is a different group, because the first group were the more senior doctors at the tertiary hospitals, and these were all specialists or subspecialists. Then we looked at doctors in Jordan, and here we used respondent-driven sampling approaches, something that's not commonly used in conflict situations, but is very good for uncharacterized populations. And we asked doctors about their experiences in Iraq before leaving. So where were you in 2003? Where were you in 2004? What was happening in that facility during this period of time? How many doctors were you in your hospital in 2004? And then we asked various events. So we could develop then both a denominator and a numerator here. And we use 3 seeds to start the process. Those of you who've not used respondent-driven sampling, the idea is after these repeated waves of recruitment, by the time you get to about the 6th wave of recruitment, the idea is that the sample is now approximating a random selection of a group. And these 3 seeds ran between 10 and 12 waves in the 3 chains. So this is one of the kind of chains. So if you're recruited, you get 4 coupons to recruit other people. And then those people will then in turn get 4 coupons to recruit additional people. The idea is to diversify your networks, and by giving 3 or 4 coupons and limiting that, it means that you can usually extend the chain, so you can stretch out a bit further. This is a method that's used frequently for HIV type studies, and these have codes about who refused and who was accepted and so forth. So this is just part of one of the 3 chains that we did.